This is a video about common side effects of the mostly used PDE5 inhibitors, which are Viagra, Sildenafil, Cialis, Tadalafil, Levitra, Vardenafil, and Stendra, Avanafil. This video will not cover cardiovascular disease because I already uploaded that. So if you want to know more about the interaction between Viagra and the heart, I advise you to watch this video. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist and a fellow of the European Committee of Sexual Medicine and a fellow of the European Board of Urology. I work with these drugs on a daily basis, meaning that I not only passed countless exams on this stuff, I also have over 20 years of clinical experience with the effects and side effects. The first thing that you have to understand about side effects is that not everybody gets them. This is very important because most people are of the opinion that you can't get any effects from a drug without side effects, which is nonsense. First of all, it depends on the drug. There are drugs which have inevitable side effects, like, let's say, selective alpha blockers, which reduce the amount of seminal fluid, or anticholinergics, which will cause a dry mouth, which is also a little bit dose dependent. But there are lots of medication that don't cause side effects in most patients. PDE5 inhibitors like Viagra or Cialis may serve as an example here. So this is like a dream come true. Most patients who are on these drugs don't experience side effects, just effects. Side effects are classified into different categories. Very common, that is 1 out of 10. Common, that is up to 1 out of 100. Less common, which is up to 1 out of 1,000. And rare, which is up to 1 out of 10,000. In this video, I am only talking about the very common and common side effects. Headache is the most common side effect across all 4 drugs. It occurs in around 15%, which means 15 out of 100 men treated. In other words, 85 men don't get headaches. The next common side effect is flushes. So 10 out of 100 men will experience a redness of the face. This side effect is much less pronounced in Cialis, Tadalafil, where it occurs in 4 men out of 100 only. Nasal congestion occurs in 10% in Stendra, Avanafil, and Levitra, Vardenafil. It is less common in Viagra, Sildenafil, and Cialis, Tadalafil. However, Cialis has a special feature which is quite common, and that is not seen in any of the other drugs. The PDE family has 11 members, and Tadalafil also may act upon PDE11. As a result, about 5 out of 100 patients will get very uncomfortable muscle or back pain. Mostly they will complain about pain in the lower back and back side of their thighs. When this happens, I counsel them to stop the drug until the pain has gone. When they restart the medication on a much lower dose and longer time intervals and gradually increase the dose, very often the pain will not come back. Heartburn is quite common too, especially in Cialis. In general, every person reacts differently to these drugs. They are kind of the same and act similarly, but they are not identical. Therefore, it is a good idea to try several and see which one works best for you. PDE5 inhibitors can be divided into 2 classes, short-acting and long-acting. Viagra and Levitra are effective for a couple of hours only and leave the system quickly within hours, whereas Cialis and Stendra are long-acting. Depending on individual efficacy, they may be effective for up to 2 days. One thing about efficacy and addiction, there is no habituation effect with these drugs. If higher doses are required, this has to do with a deterioration of the overall erectile ability. And another thing is, you don't get addicted to them. However, I try to avoid giving them to certain patients, especially young patients. I call it the Dumbo effect. You know, Walt Disney, Little Elephant. Dumbo can fly with his ears, but he believes he needs to hold on to a feather for this and doesn't believe he could do without. It's the same with some patients who have good erectile ability but don't believe they have and think they need a pill for safety reasons. Thanks for watching. Please don't forget to subscribe to UroChannel. Bye bye.